Is it safe to run if you have knee arthritis? Does running cause knee arthritis? Or if you already have arthritis, can running make it worse? Contrary to popular opinion, there is no evidence that recreational running causes or worsens knee arthritis. In fact, there may even be evidence to the contrary. Research shows that only about 3.5% of recreational runners develop knee arthritis. That's compared to 10.2% of the sedentary population. So recreational running may actually be protective of your knee cartilage. Now, there is a limit to that. If you run too much, it actually may cause cartilage damage. 13.3% of ex-elite or professional runners develop knee arthritis. And so it's not necessarily a question of is running good or is running bad, but rather how much is appropriate. There's a frequent acronym used in fitness called FIT or FITT. That stands for frequency, intensity, time, and type. And there's another T that I'll add to that at the end of this video. But first, let's go with the original acronym FITT. Frequency means how often you run. And for most recreational runners, about every other day or 3 times per week is good, especially if you're just starting to run or if you're getting back into running after an injury. Ideally, you want to allow 1 day for your muscles to recover as well as for your joint cartilage to recover from that repetitive compression and distraction. But when you do that repetitive compression and distraction, it stimulates the chondrocytes, the cartilage cells within your joints. It also lubricates the joints, and so moderate running is good for your joints. Now, intensity comes down to your speed. That's basically how fast you're running. Type is running, obviously, but there are different types of running. For example, are you running continuously, or are you walking for a period of time and then running for a period of time? If you're new to running or just getting back into running, breaking it up into maybe 1 minute of running and then 2 minutes of walking, and then 1 minute of running and then 2 minutes of walking can be helpful at first. As that gets easier, you can go to 2 minutes of running and 2 minutes of walking, 2 minutes of running, 2 minutes of walking, and then 3 to 2, 4 to 2, etc. Now, how long should you run? That depends largely on your fitness goals. However, you should be able to walk for at least 30 minutes before you start running. And so if you're just getting into running, it is a good idea to maybe set a 30-minute workout time and then alternate the running and walking as I described before. Now, there is one other T that is very important in regards to running and knee arthritis, and that's technique. Running with proper technique will cause less strain on your muscles and joints. It also makes you a more efficient runner, so you can run faster and longer, expending less energy. So the first thing we'll talk about is cadence. Whenever I evaluate someone to look at their running technique, that's the first thing I look at. And interestingly, the ideal running cadence is around 170 to 180 steps per minute, regardless of your running speed. And the reason for that is your speed is determined by your stride length times your cadence, or how many steps you take per minute. Now, stride length is the distance of one stride. Your cadence, however, has to do more with the vertical distance of your stride. Every time you push off, part of your force is directed horizontally, another part of your force is directed vertically. And the only way to slow down your cadence is to go higher and then come back down, go higher and come back down. And because gravity is accelerating downward at a constant force, regardless of your horizontal speed, that cadence really doesn't change that much with your running speed. So if you're running at 170 to 180 steps per minute, that's a pretty fast turnover rate, meaning you're not leaving the ground very high. As your cadence slows down, you're creating more ground reaction force and staying in the air for a longer period of time. And so running with a faster cadence causes less downward force, which means less compression on your knees. The next technique point that we'll look at is the horizontal distance of your stride. If you're coming too far across midline, that creates a lot of stretching on the outside of your hip, which can irritate your IT band or cause hip bursitis. It also makes you a little less stable because your hip is going into more adduction. The other thing you want to look at is how much internal rotation you're getting. This is sometimes referred to as heel whip, as when you're running, you'll see people's heels going out to the side like that. Now, even though your heels are going outward, it's actually internal rotation of your femur, and that internal rotation of the femur can create a whole host of problems in your back, in your hip, in your knee, or in your foot. So trying to keep your legs about hips width apart and not rotating too far inwards is ideal to help protect against injuries. It also makes you more energy efficient. And then the final thing we'll look at is your landing, where you're landing on your foot. If you land with a heel strike, that creates a large downward force, and it sends that shock up through your chain to be absorbed somewhere else, whether that be in your knee or in your hip or in your back. Conversely, when you hit with your whole foot at the same time, it uses the arch of your foot like a shock absorber to help diminish how much of that ground reaction force gets sent up to your knee or your hip or to your back. When you do land on your foot naturally pronates or flattens a little bit, which helps absorb shock, but then it needs to come back into supination in order to create a rigid lever for you to push off from. So as you want to land with your whole foot arched at the same time. You want a little bit, but not too much pronation, and then push off the big toe coming back into supination of your foot. So you'll hit with the whole foot, pronate a little bit, push off the big toe. And that does tend to happen more naturally as you increase your cadence to around 170 to 180 steps per minute, which is again why that fixes a lot of running problems just on its own. So hopefully this video did help you decrease your fear of running if you do have knee arthritis, or help you learn some tips to decrease your knee pain if you happen to have pain when running. If you did find this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.